Good morning, everybody. So today we'll wind up our discussion on an Aetcom lecture, that is communication skills. Already our teachers have explained you like what is the communication skill, what's how you communicate to the patient, okay, and how you gain confidence when you communicate to the patient, how the patient gain confidence, what's the placebo effect, what he thinks about you when you interact with the patient, and how best you communicate to the patient. Okay, so you see in the learning objectives what it was discussed, that regarding the communication skill, the importance of doctors patient, the importance of doctor patient communication, because the only thing is that you have to pacify and see that how the patient feels when they visit to you. Okay, and you have to give you have to be eccentric and see to it that you are communicating to the patient what you expect to tell and what he expect to perceive. That's also important, because it should not be one way communication, but it should be both the way. You can be a good listener and good convincer, but at the same time you see what the patient want to tell, what he's having, what's the idea regarding what is this, because the patient may be suffering from the ailment for a long time and he has got certain tests done, certain he has visited some other doctor also, isn't it? So you get to know like whether he is having a thorough idea regarding what he is suffering from and how he is get cured, isn't it? So those things we have to keep in mind when we communicate. So here we have essential elements of communication, the 5 behavioral changes model which we already discussed, and the various protocol for different situations, like what's the different situations you come across and how you're going to handle the patient through your communication skills. Okay. Now communication skills we have already discussed earlier, that communication skills are the ability of one users when it receiving different kinds of information. So ultimately we are perceiving the information. So how you're going to perceive the information is very important. It can be like listening something, or you can see some audio, or you can hear some videos. Okay, speaking, observing. There are so many ways in which you communicate. Sometimes without speaking also you communicate to the patient by your body language, isn't it? So this is how the different involvements of communication, like listening, speaking, observing and empathizing. So these are the ways in which you communicate with the patient. It also helps to understand the difference in how to communicate through face to face. Sometimes face to face also will give you some facial expressions also matter. Okay, so with the face to face interaction and with phone conversation, like when you talk to the phone, you should be polite, you should be gentle, you cannot be just talking rudely to the patient. Okay, you listen to them calmly, then you try to reciprocate them, then you try to give your suggestions to them. So this is how you communicate. And sometimes you have a digital communications like email and social media. Okay, so there are various ways of communication through which a patient can be communicated through the doctors. Now here, communication skill as such is everywhere. Okay, it's not only in medical fraternity, it's everywhere. So how you communicate the thing is important here. So in medical education, you find this communication skill is extremely important, because that develops an integration to become effective health provider. If a patient is coming to you, how you approach to the patient, that's important, so that message is taken home back to the patient, and he will tell to 10 people, okay fine, this doctor is nice, this hospital is nice, and their treatment is nice, the way they talk, because half of the ailment is sorted out when you communicate to the patient very well. Okay, so in the recent years you observe good doctor patient communication has been linked with the improvement of patient satisfaction. That's very important. So when you communicate, see to it that the patient is satisfied by what you want to convey to them. And also it should be open, it should be double-ended. It's not only one side you throw something and you expect that thing to follow this from the patient side. So patient also can exchange something. You should also be a good listener at that time, and you give suggestions and you give the open-ended thing, so that whether he or she is agreeing to you and your plan of action, like what you are going to do with the patient in the future course of time, when you interact, when they visit in the hospital in future days. Okay. So these are the different important factors in the communication skills, and this is what they talk about. Physically challenged, how you can communicate with a patient. Now why communication skill is important? Because it will elicit you proper history from the patient. The proper history of the patient can be taken when you start from zero, when you start from the start, when you start how you start collecting information in a gentle, polite way from the patient. Okay, accurate diagnosis and management in medical practice. So this is also important, because unless you get a proper history, you will not be able to do those things which are required for that particular disease. Okay, so getting information from the patient is very important. So when you get a proper information from the patient, then you may be having some few tentative diagnosis. With that line of thing, you just go for the diagnosis. Okay, and then with the help of the lab findings and the radiological findings and all these things, you are able to arrive to a particular diagnosis of the patient. That's there. So good communication skill is prerequisite for an effective physician-patient relationship. Okay, so this is an important here, because communication skills everywhere is important. Some people are very knowledgeable, but they cannot communicate to them. So what happens? People will perceive that the fellow doesn't know anything. So you have to be a good communicator. That's very important, because the patient may be sometimes not knowing the medical terminologies. You have to explain in a simple language to the patient, in a local language. These are the barriers which come. Suppose you are a non-Bengali speaking and the other person is Bengali. So if you are not able to speak, you have to use some common language, or you use translators to transmit the message what you want to convey to the patient. Maybe you are talking something, the patient is in other line, he may be seeing your face and you think that he is or she is understanding your communication. No, because he is not understanding your language. So there can be a language barrier also there. Okay, so these are the things which you have to think whether you, okay, before you start the communication, you have to talk, okay, from which place you are, whether you know this thing, okay, where do you stay. That is how you approach to the patient. Okay, a systematic search in the medical literature have been made to formulate the guidelines for better communication. So there are some guidelines which is done to formulate, which has been formulated for the better communication process. Now during history taking, the guidelines emphasizes both physical environment and emotional encounter, and the key points are expressed at the tips of relevant issues. So you have to think the apathy of the patient, because he has come to you with certain problems, and when you communicate to them, when you talk to them, when you feel that when you feel her or him that you have come in the right place, okay, and you will definitely get, you have to give that boostness, you have to give that boostness through words. You have to talk something which the patient feel happy, because half of the ailment can be sorted out when you communicate, when you give time to the patient, because every patient is your customer. Okay, proper greeting and meeting is very important. So you have to, there are certain body languages which you should know how you communicate. It's not that you are sitting, then thousands people will come to you. The reputation is very important. Today you spoil the reputation, tomorrow nobody will come to you. So it's important that when you communicate to one patient, that let be a example that, okay, fine, this doctor is very nice, he communicates, he gives time, because that is what the patient carries out. Okay, he listens to me, he talks to the problem, he solves the problem. This is what you are going to carry out when you have this communication with the patient, and that same patient will suggest some other of his friends, relative, families to visit you. So that is how you are going to increase your customers. Okay, that is how you are going to increase your number of patients, because that interaction between you and the patient is critically important. Now there are different approaches in which the doctors communicate with the patient. Now the patients are nothing but consumerist. Okay, so doctor can be passive, they can be second opinion, a referral to the hospital, etc. So these are the things, like if he is coming, if you know that this particular case cannot be treated in my hospital or something like that, or in a clinic, then what happens? You are going to suggest that few different hospitals, that these are the hospitals which are really nice, you can go ahead with this and communicate with me, keep in touch with me in case any problem. So this is how you are going to specify, this is how you are going to communicate to the patient. Okay, doctors take a role of parents in patient submission, because when you communicate to them, he or she should feel that you are just gentle with them, you are able to listen their problems. Okay, what she is communicating to you, you should listen and then you are going to get, you are going to suggest some best possible solution to that with an open-ended, like, okay, fine, you just throw off something. Whether the patient is able to take up that one, whether the patient agreeing to your thing. Suppose he may be having some plan, okay fine, after 10 days I am going in a vacation and I have come for a checkup of my sugar because I am a diabetic. So what's the possible suggestions you are going to give? You cannot tell, nah, fine, you have to not, okay fine. You cannot implement certain things that it will spoil the whole mood for that person. You are going to suggest few possible things, okay fine, you are going to do these tests and we'll see your blood sugar. If this is high, then I can give you some dietary advice, he can enjoy his vacation and come back and get the, in case you have some problems when you are outing or in case of vacation, I'll try to communicate to some doctors there nearby area where you're going to have a visit so that he can communicate or she can come, you can approach to her. That is how you're going to suggest to the patient. That's very important. Okay. So mutuality, this is also important, equal partner, joint ventures and exchange of ideas. This is ultimately an exchange of idea from the patient to the doctor. Okay, building of relation, how you meet and greet, that's important. You see here, greet and meet shows interest in the patient as a person. That's very important, how you communicate. You have to go eye in eye contact. You have to lean, bend down toward the patient. It's not that you do sit like this and talk like this. You are not a boss. You are a parent, you are an advisor, you are a doctor. So you have to gain confidence that patient should or he will get cured through your treatment. That is important here. Okay. So when you build up a relation, that's very important. A patient is coming, ex-patient is coming to you, how you are going to build up relation with the patient. So you see here, introduce yourself to the patient. I am such and such doctor, I am such and such, I am this, I have worked in this one, this I am attached to this. Like this, you give a brief history to the patient. Okay? Explain your role. What is your role there? Shake hands, but don't force physical contact. Somebody may not be so much comfortable when you shake a hand. So it's not necessary that you put your hand and the other person, no, don't do that. It's a gesture. You have to try it out that way. It's not necessary that when you greet, you have to shake hand with the patient. Call the adult patient as Mr., Mrs. and Miss. That is how you're going to, not by the name. Name comes only when you're a close friend. She is not or he is not your friend, so you call Mr. such and such. That is how you're going to greet the patient. Maintain privacy. The patient has come to you to share some problems, to share some medical elements. So when you communicate to the patient, see to it that third party is not listening to your communication, because otherwise if other is listening, then he or she may not be comfortable in sharing the information what she wants to convey to you. That's extremely important. So when the conversation is there between the patient and yourself, you see to it that the secrecy is maintained or the privacy is maintained, and you build the confidence with the patient. That's important. It's not that she has shared with you some information. It's unethical to talk about this patient's problem to X, Y, Z. It's unethical. Okay? So you have to keep the confidence. The patient should gain confidence in certain things which can be very personal and he or she has shared with you. It doesn't mean that you make a mockery out of that and you start telling to X people or in your friend circle. Then what happens? The identity is lost. The secrecy is lost. The ethical, this thing is lost. So that you should not do. Okay, because he has thought you as a doctor. He has shared or he or she has shared all the information with you regarding his possible ailments. So in that case, you are supposed to gain confidentiality in that. That's very important. Now use the words which shows care for the patient. That's important. You're concerned for the patient, you care for the patient throughout the interview. So if you communicate with the patient, see to it that the patient is getting confidence when you're talking to them. In between, you're slowly and gently taking the information, you're taking the history of the patient. Okay? So ECE, we have recorded certain lectures. You see the ECE lectures, how the patient interact, how the doctor interact with the patient. Like you see in 10-15 minutes interaction with the patient, he gets all the information without being known to the patient also, like what and all you asked. Okay, that is how you retrieve the information from the patient. And this can happen only when you politely talk to the patient, when you gain confidence with the patient. Okay, that's why this care for the patient is very important. Because if you don't care today, tomorrow he may not come to you next. Okay, so the concern and care is important. You have to listen to the problem what the patient is having. You cannot be just dictating and telling something and you expect the patient to follow. No. That's why I'm telling it should be both end. Communication should be both end. You have to be a good listener, you have to be good orator. These two things are there. Now you see here, use tone. It should be gentle, not very rude when you talk to the patient. Okay? See your pace. Eye to eye contact is important. That means you're talking to the patient. If patient is here, you're seeing like this and talking, what the patient will think about you. So when you talk to the patient, you have to see that these minimum gesture body language is there when the communication is happening with the patient. Okay? Maintain open position, lean forward toward the patient, eye contact is maintained, the patient. And these are the important postures which is required when you meet and greet a patient, when the patients come to you as a customer for the first time. Okay? Allow the patient to complete opening statement without interruption. That is very important. So what happens when the patients are, okay, ki hoche, what happened to you like this, why you come here, I am doctor such and such, like this you tell. So if the patients are speaking, you should not interrupt, you listen quietly to what he or she is want to convey. Okay, so silence is golden and it takes a lot of information. It gives you a lot of information. So patient is maybe doing important homework before she makes the first statement. Okay, so definitely don't think the patient is ignorant. These days everybody is knowing all facts. You cannot fool a patient. Those things has gone. Okay, those things has gone. So listen to the patient. When he tells you the story, when he shares with you something, that means he is giving a clue for your diagnosis. That's important. That is how you are going to click to that particular thing, that this could be the possible diagnosis and how you are going to manage that one. Okay? In that case, you tell your plan of action, like, okay, fine, you are suffering from this, what is your sugar level, or you have to use a lipid profile level, or what, suppose a kidney patient is coming, or a patient who is having a history of having this dialysis all throughout the time, then how best you can convey to the patient, how can you see that the patient is feeling comfortable with you, and you are going to give suggestive advices like, okay, fine, regarding the dietary advices, regarding the different line of treatment, you tell, okay, these things are there, we'll start giving this one first, we see if it doesn't happen, then we work out with these drugs, if doesn't happen, we have the third class of this thing. So like this, you are going to get step by step your plan of action for this treatment to this patient. You are going to share the information, the patient agrees to that, then only, because the patient will be confident, not that a patient coming to start looting it. You start convincing something which will earn a lot of financial in this thing for you as well as for the hospital in which you are associated with. Don't do that. Okay? You have to be clean and quiet. That's very important when you communicate to the patient. And when you tell everything bluntly, you give an open suggestion. Okay, fine, this is the thing we are going to do. What do you think? This the cost will happen, this much is history of this will be cost for diagnosis, this the things will happen. So this is how you are going to treat the patient. If the patient agree to that, then only you are going to talk about further course of action. Okay? So that is what important. So when you open a discussion, how to open the discussion? When you ask, is there something else to elicit full set of concern? Like a patient has told something, then you ask, okay, is there something else you want to share? Or something you have forgotten to share? Okay? These are the keywords which you are going to use when you communicate with them. Explain an agenda for the visit, identify the reasons for the consultation. So these things are extremely important from the patient side also. Like, what's the reason why you have gone for consultation? Maybe definitely you are not satisfied with some previous physicians, isn't it? That's why you have changed your doctor. It can happen. So you have to gain the confidence with that. The patient should think, okay, fine, eta bhalo ache, ekhane dekhabo. Like this, the thing should come like that. Get my point? That feeling should come from the patient end. But he or she will not be able to tell you at that moment of time while interaction. but he or she will tell about your opinion to X person or Z person. Okay? So that is how the first initial breaking of communications will look like. You are going to communicate in such a way. So the first thing which comes to our mind is how you gather information from the patient. That's important. So you should be open questions, closed question, leading questions. So you categorize the questions, queries which you have from the patient end. Always start with an open-ended questions and take the time to listen to the patient's story. That's very important. You're going to listen to the patient's story. Let him or her share openly what was the ailment for what she or he has visited you. Okay? Once the patient has completed the narrative, to close question which clarifies and focus aspects can be used. So once the patient finish up the discussion, then only you start your discussion with them. Okay? And in the conversation, what you find, there can be some leading questions, like question based on your assumptions that lead the patient to the answer you want to hear, should not be used at all the time. So something you expected and that patient has told through your mouth, that is how you extract the things from the patient if you give free hand to talk to you and give some time. So time when you communicate with the patient will give or will help you in arrive at tentative diagnosis. Okay? And in that time you flicker, like you think, okay fine, this could be that, this could be that, this could. So these are the ideas which is running in your mind when the patient is trying to convey to you, when the patient is trying to communicate to you, when the patient is open with you at the moment, the first interaction with the patient. Okay? So these are the things which you must give an open thought process for the patient. Listen to them. Listen to them. You cannot be just putting something in between. No. You first allow her to complete the whole narrative, what she is trying to tell you. So once it's over, then only you start speaking and you said, okay, fine, this was that. You recall what she told. And with that, you give a suggestive possible solution. And you give the mode that these are the things which I think, so I think it's better to prefer to do this test, this particular test, this particular, and you please visit to us after a few days when the test is done, so that we can open up the discussion further regarding that line of treatment with you. That is how you're going to communicate with the patient. So opening session, this is an opening session is there. Clarify the detail all necessary with a specific yes or no questions. Okay, with the patient. Summarize and give patients opportunity to collect and add information. After that, you have to summarize. You are writing in a small note. Okay, fine. This telling this is what she is telling. When you tell, like I was having this high, my protein value was this much, my Ag ratio was this much, my chloride was this much. So you keep writing the notes slowly, strictly, when the patient is giving information. Then you think that what could be the thing, and that is how you're going to open up. Okay, fine. I suggest this more further test can be done, or you can tell that okay, fine. This test was missed out. I think if you do this test, we can narrow down our diagnosis. Okay, so that is how you're going to communicate. Continue with the opening session with the patient. Transition effectively to additional question. Ask about life events, circumstances, and other people that might affect health. So these are the things which should be open, which should be asked to the patient when the patient has conveyed you the proper history with that while narrating by brief story what he or she has shared with you. Understand the patient perspective also. That's important. You see in which socioeconomic group the patient belongs, whether they are in a suggestive solution like this could be the treatment, whether the patient can afford. No. So how can you go best with the patient? Okay. So mutuality is important, equal partner, exchange of idea, and joint venture. These are the 4 parameters which the patient's perspective can be understood. Okay. So what happens when the communication of the patients has ended? Suppose you communicated, the patient has communicated, we almost a discussion was 10 to 15 minutes. Then you are writing up this one, and then you include the patient's choice and decisions also. Let the patient choose from the cafeteria different mode of treatment. So this is what, when you understood what the patient is having, Because he is sharing his apathies with you, you have to be empathizer. Okay? And the moment he or she finished, then you start your discussion. Then you give the choice. These are the choice, these are the mode. Now which one you opt for that? Because you have to see whether the patient is comfortable with what you suggested, or you cannot just put that thumbprint, okay fine, you have to do this. No. You have to open from your side also. Let the patient choose. If suppose he or she cannot afford this, then what's the different ways, the best ways, possible ways in which the solution can arrive. Okay? So according to that, the patient should be given a choice of treatment modalities. You cannot be writing prescriptions and just giving us so much of test which is not required also. These days nobody is fool on earth. Everybody knows what is happening. Okay? So you cannot tell I am a big doctor. No. If you think like that, then you are cheating yourself. Always should be calm, quiet, easily accessible with the patient. Suppose a patient has got your treatment, he has missed something out which he wanted to ask to you. Let you be open. You give the number. Let the patient talk to you anytime. The patient is obviously knows that when you are free or when you communicate to them, you can just tell, okay fine, kichu problem hole, you just communicate to me. Okay, you give the certain time from 9 o'clock in the night, I am available, I am free. So in case of that, you want some suggestions, I am there to help you out. Or fixing the next meeting with the doctor. Doctor may call the hospital and may try to communicate to you, doctor, I am coming in such and such date, I have got this test done, these are the parameters which I have got. So she cannot explain to you the test results, and also in that case he will get checked through you. So she want to pay visit for the next time in the hospital. That time she will bring all the reports, and by seeing your reports you are going to convey what you understood with the report, like what could happen to the patient. Okay? And then further test if required, and how you are going to approach to the patient, explain everything clearly. That's very important for the patient as well as yourself to gain the building relationship with the customers. Okay? So agreement, see agreement, how to close opening session. These are the things which already been discussed. See placebo effect, this is important, placebo effect. In placebo effect, when you talk to the patient, half of this element is sorted out. Okay? So with this will show how concerned you are for the patient, how concerned you are. So a patient will tell others, okay fine, this doctor is very nice, this doctor gives a lot of time, this doctor is down to earth. Okay? So like this, these are the things the patient will carry throughout the conversations from you, and this get amplified to other people. So see here, these are the keywords in which the importance of a doctor-patient communication. You see here, a doctor while communicating to the patient should be active listener, eye-to-eye contact, should be empathizer, respect, understand, and responsive. So these are the things which should be there in your mind when you communicate to the patient. Active listening. First, when she opens, narrate the story, you should be actively listening to it. Not that she tell and you talk to somebody like this. So that she will tell, you will talk here, you talk, not like that. You have to be very calm, attentive to the patient when she is open discussion with you. Okay? That's very important. Eye-to-eye contact, because that shows that you are concerned about the patient. You are showing interest for the patient. So eye-to-eye contact is very important. Then empathy. You should be empathizer. Okay, fine, it hoega, no problem. Again, we'll try to do. Don't worry, life is this thing. This will happen. So these days, everything is treated. It's not that this end of it, isn't it? So we give various possible options for the patient. These are the things which we think. Now, whether you are comfortable with this mode line of treatments or not. If it is so, then we can go ahead. Or else, what do you think? Please give an open suggestions. Because the patient will not know the mode of line, but you explain them in a very layman's term, so that he or she understands your degree of problem and how this best can be sorted out. Okay? So these are the things which you keep in mind. There is something called as Kalamazoo essential elements, which madam has already communicated, which already discussed with you. In Kalamazoo statements elements, there are 21 parameters. A group of 21 medical education leaders, they have framed this one in 1991, and we use as a checklist because the interaction of the patient with the doctor will have these parameters. And what you do is you are going to put this parameters and in the form of questionnaire. Through a Likert scale you compare whether the patient is comfortable, like smiley is there, if you don't like, if you don't understood it also, there are various 4 parameters through which the patient is communicate and you keep on ticking that one. Okay. You see here, this is the way the question, see here, done well, needs improvement, not done, not applicable. So these are what? These are the Likert scales comparison. So you see here, building up relation, open discussion, gather information, understand patient's perspective, share information. So everywhere, these are the questionnaire, and you have to see whether you have done well or not, whether you do this or whether not explained, or you are happy with this. So these parameters can be adjusted with this Likert scale, and finally you compare your this thing. So as far as the behavior model is concerned, by the Glasgow, which was framed by Glasgow in 2002 and Whitelock also in 2002, is a self-management action of the chronic illness patient will plan, including the following things. You are going to assess the patient, you are going to advise the patient, you are going to agree with the patient, you are going to assess the patient, and you are going to arrange the patient. Okay? Arrange for this patient. So these are the 5 A's which are essential in the behavioral changes model. Then you see here the one question is there, you have to plan accordingly how you communicate to the patient. This is a 1-act play which 3-year-old, 31-year-old male comes to your laboratory for a premarital hemoglobinopathy screening before getting married. You have reported him as a beta thalassemia major. Beta thalassemia major, you know that hemoglobin may not talk, okay. The patient repeated the test in another laboratory and found beta thalassemia trait. You told beta thalassemia major, the patient repeated the same test in another laboratory for beta thalassemia trait. 4 days later, the patient revisited your laboratory with agitation, angerness, because the reports doesn't match. After that, you found it that beta thalassemia trait in your laboratory too. How will you communicate? So they can be mistake. How best you can communicate and pacify the patient is important. If you don't able to convince the patient, okay fine, there were some errors, this one, we'll repeat the test free of cost and we'll do this test again. So the patient's agitation can be nullified. The first is that when the patient is outraged, you should not be outraged. You should be keep calm and quiet, smile to him, the half of the angerness from the patient will go. Okay? And then you tell your problems and you make him understand this could be the possible problems happened. So let me repeat the test and find out second time what is happening, what's the disorder. Okay? So that is how you are going to communicate. He is a known case of diabetic. His fasting blood sugar is suppose 130. He has recently visited your lab and you reported it 150. The patient might think that there could be a problem with it myself because lab report shows 130 to 150, 20 error, 20 milligrams per deciliter error is there or higher is there. Then whether I should increase the doses of medicine because this and how long it's happening. Okay, so these errors it can happen from the lab because the reports doesn't match with this one. And in a few days interval of time, the reports will not change that variability. And the patients are also clever these days. They get the reports done from your lab, they will go to X lab, they will go to Y lab, compare the values from these 3 labs. It is not that they get your blood sugar done 150 and she doesn't go to any other lab and say start treatment. No. Before treatment, patient is also clever. He'll consult some other doctors also and consult his diagnosis for the diagnosis, and also he will go for other labs who do the same test and see whether this lab report is 150 is accuracy matching with that. No, there is coming 110. Then obviously he or she will he or she will get agitated because the whole agony what she has undergone by expressing of values of 150, who will take the responsibility for that, isn't it? So that's why when also you do a test, you see that you recheck the values before you dispatch, before you give the reports, before you hand the report to the patient. Okay, instead of handling report, error report, better communicate to that. It take the history from the patient. So these are the elements which you must look around. There's something called as cones, you see, a protocol for discussing a medical error with the patient and family members. Errors can happen. So in that case, you're going to discuss context, opening shot, narrative, emotions, strategy and summary. So these cones will give you an correction of errors from the laboratory, correction of errors in any medical mode line of treatment. Okay. So this is what we have discussed, and I hope you understood how as a doctor you are going to communicate to the patient. Okay. This class is already dealt earlier with ma'am and sir. My was to disclose, discuss and close this topic. So this ultimately the motive was to understand your patient very well by means of communication. Communication is very important, and with the communication, how you gain confidence with the patient, how the patient gets free with you, how the patient feel comfortable with you, and so that he or she will come next time to you because he is satisfied by visiting you, and in further course of action she will get few people also, she suggest few people also to visit you. So ultimately it's a PR relation, how you are going to communicate to them, how you feel gain confidence with the patient, and in future you are building up relation with the entire society, because there are thousands of doctors, but how many doctors is known by everybody, that's important. Everybody is not known, right? Somebody is practicing in Gopur, somebody is in Max. So it depends what grade. You cannot tell yourself a big doctor. Recognition is important. Recognition comes through a good relationship with the patient, with the society. You cannot think yourself as a god and try to demean others. You have to learn to pay respect to others and get respect from others. Okay? So these are the points which you keep in mind when you communicate with a patient. Okay? So with that we wind up our discussion on communication skill with the patient. I hope this is extremely important. When you go in the second year, you will be having gently seeing your doctors who will be working with the patient. You are going to observe that time how the communication is done, how you gain confidence with the patient. This is important. Okay? Thank you so much.